As we've said before, one of the big challenges of fighting a very quickly spreading virus is that we have to learn about it in real time while we're trying to fight it in real time. And while it has taken a while to get some breakdowns of the number of cases and deaths by race and ethnicity, we are starting to get some of those data in, and we are seeing that COVID-19 is disproportionately affecting the Black community in Connecticut. Now, Dr. Cato Laurencin from UConn Health was a co-author of one of the first studies we know of that has been both peer-reviewed and published on the subject, and he joins us now over the phone. Doctor, thank you so much for taking the time to join us. And let's just get right to it. I know you said in your research paper that I read that hopefully this study will explode what you call the myth of Black immunity to COVID-19. Can you talk about the interesting origins of where that came from and just how prevalent you think that myth is?
Well, thank you. When we look at the internet, the end of March, the second and third week of March, I was fairly shocked to see if you place the keywords Black and coronavirus, that most of the points that were coming up were centered on something called the myth of Black immunity, or the question of Black immunity, that Blacks might be immune to the coronavirus. And actually, it's interesting. It actually goes back to an observation in China that a Cameroonian individual had the disease, and they thought it was a very mild form for that person. But needless to say, that myth in terms of Black immunity had spread throughout the internet, and that really worried me and my colleague, and really motivated us to say, let's get the data on Blacks and coronavirus in the state. And so we went to the state of Connecticut, and in fact, they had not been publishing data on race and ethnicity and coronavirus, and we had to push and say, listen, this is something that really needs to happen and needs to be on the website, and got the earliest data. In fact, the data that we have had not been published on the website before. And it really shows at the earliest time points that Blacks are both being diagnosed with coronavirus at a higher rate, and also dying at a higher rate. And over the last 3 to 4 days, we actually gathered the data March 31st, April 1st, and published the paper a few days after that. But now we're seeing across the country, certainly in places such as Chicago and Milwaukee, where they are saying the same thing, that these numbers are high for Blacks.
Yeah, and with a fast-moving virus, even those 7 days between the numbers and today, a lot can happen, but the numbers seem to even be getting worse. As you put in your study, about 12% is the Black population in Connecticut, but they're seeing cases at over 17, close to 18%, and deaths at 15%. So, folks, that's what we mean by disproportion. So, Doctor, what is behind it? I mean, knowing what we know about the disease, it seems like every single way in which the Black community has been systemically disadvantaged over time is working against them even more, given what we know about this virus.
Right. I think you've just summarized it in a nutshell. Number one,
I'm sorry, I didn't mean to do that.
But it's important. It's important to really discuss this. One is that obviously comorbidities are higher, and areas such as asthma, heart disease, diabetes are higher in the Black community. And the second is levels of poverty are higher. In the country, I think whites are 8% in poverty, Blacks are 20.8% in poverty. Also, access to care, and while things have gotten better, thanks to President Obama and Obamacare, access to care has traditionally been a difficult for the Black and brown communities, and so that affects, especially in terms of chronic illnesses that have taken place over a long period of time, affects the chronic illnesses that are there. It's also there are also some social factors that are involved. The percentage of blacks who can work at home versus who must work outside the home during this period is much higher in the black community than in the white community. And so individuals the blacks are taking jobs or working in jobs in which there is much more chance for exposure that's there. I think also, to be frank, I think that the internet, in terms of social media and the myths that were portrayed in the first in March, stating that there was some level of immunity was something that may have hurt hurt efforts that were there, and we're glad that we were able to gather the data and get the paper out quickly to make sure that people knew that myth was really a myth and to explode the myth. And of course, we know that discrimination and racism continues now, and actually it's a cycle that actually interfaces into every component of what we're talking about in terms of comorbidities, poverty, et cetera. And that continues now, and that's also a factor that also plays into the continuation of this coronavirus epidemic hurting the black community.
Well, Doctor, if nothing else, these 3-4 minutes we spent with you is hopefully going to explode the myth even further, because knowledge is power, that people know this. And we'd love to connect with you again to maybe talk a little bit more about what we can do about it once the nation collectively gets its feet under it. But thank you so much for that study. Thank you so much for taking the time to talk with us today, Doctor.
Thank you very much.